You know, it boils my blood to sit in the waiting room with my daughter as she suffers with a migraine headache for 6 or 7 hours with other screaming children when we have thousands of doctors that could be helping reduce those wait times for all of us, but are banned from doing so because despite their qualifications, they cannot get a license. Government bureaucracy and gatekeeping prevents people in our country who are trained as nurses, doctors, and other professionals from working just because they were trained either in other countries or in other provinces. Today, we have 19,000 Canadian doctors and 34,000 Canadian nurses banned from working in our hospitals simply because they were trained in another country, including advanced countries. In Canada today, we have a doctor shortage of about 40,000. In other words, if we had all the doctors that are here today in Canada but trained abroad working in our healthcare system, we could reduce our doctor shortage by half. Meanwhile, 6 million Canadians are without a doctor. We're ranked 26th in the OECD for doctors per 1,000 patients, despite the fact that we spend among the highest budgets on our healthcare system. It doesn't make sense. Government gatekeepers stand in the way, put in place massive delays and bureaucratic hurdles for highly qualified immigrants and Canadians trained abroad to actually get licensed to practice. I met a young lady the other day who couldn't get into med school in Canada, so she went to Ireland. After she graduated from the Irish Medical School, she had to go to California because they wouldn't take an Irish grad as a resident in Canada. And after she does her residency in California, she still will be banned from working in Canada. So she's going back to Ireland. There we go, losing a brilliant young Canadian to a foreign healthcare system when we have 6 million Canadians without a doctor. It doesn't make sense. It's time to bring home common sense to our healthcare system by removing the gatekeepers. And so today, I am announcing that a Poilievre government will work with the provinces to create a national merit-based testing standard to license doctors and nurses within 60 days of applying. It'll work like this. There'll be one standardized testing system. Within 60 days of an immigrant or a foreign-trained Canadian applying to work in their profession, they will be able to do the exam and get a yes or no based on their competency, not based on where they come from. This will mean we judge our medical graduates based on their merits and abilities, not based on some bureaucratic system or based on where they come from. It will also mean a national license so that an Alberta doctor can practice in Nova Scotia if he should fall in love with a lady there and get married and move across the country. It will also mean that the standards will be the same for people born here as those who come from abroad. And it will speed up the licensing of our medical doctors and nurses in this country. It's common sense. If you can do the job, you should get the job. If you are a doctor, you shouldn't be driving a taxi. You should have the chance to care for kids who are in great need at places just like here at CHEO. This idea is of a blue seal standard for all the professions is basically a copy of what we already have in the regulated trades. 70 years ago, the provinces and the federal government came together and created the Red Seal program, where provinces agreed to a single testing standard for electricians, carpenters, and other regulated professions, trades, excuse me. It has worked. Now a young electrician can get his ticket and work anywhere in Canada. We should do the same thing for our professions. A Poilievre government will work with the provinces who will voluntarily have the option to join the Blue Seal standard so that we get more doctors, more nurses, less gatekeepers. It's time to bring home the best healthcare in the world to Canada. It's time to bring home our doctors and nurses. Let's bring it home for Canada. Thank you, and I now turn it over to Dr. Ellis to offer more commentary as my shadow Minister of Healthcare, who's going to work on delivering this Blue Seal standard for more doctors and nurses. Thank you.